Thank you. Good afternoon. My name is Carolyn Baer, and I am the Senior Advisor for Reproductive Health for Emergencies at CARE International. Today I'm going to talk to you about the public-private partnership that CARE relies on during our emergency preparedness and response programs. Working with the private sector is critical to CARE's mission to fight global poverty. We believe that the dynamic partnerships with corporations are essential to solving complex global challenges. Let me share with you CARE's Humanitarian Vision that highlights our focus on reaching and empowering women and girls. Women and girls are often the most vulnerable populations when disasters hit. We also know that development programs can get seriously hampered by disasters and set progress back many years if the community is not able to plan for possible disasters that may hit them. So before going any further, let me set the stage of the current global humanitarian situation. As of right now, there are over 51 million people displaced around the world, including 13 million from the Syria region and over 1.5 million in South Sudan. Conflict alone forces an average of 32,000 people a day to flee from their homes. Global spending has increased by $5 billion from 2012 to 2013, culminating at $22 billion spent on addressing humanitarian needs in 2013. And contributions from private sources, individuals, foundations, and corporations have also increased by 35% from 2012 to 2013. CARE is currently responding to over 25 types of emergencies in the world and providing humanitarian relief in regional conflicts such as Syria, South Sudan, West Bank, Gaza, and the Central African Republic. We are also responding to natural disasters such as the Ebola crisis in West Africa, food insecurity in the Sahel and East Africa, and our continued presence in the Philippines following Typhoon Haiyan. A quarter of CARE's overall programmatic work is dedicated to our humanitarian efforts. There are several factors that contribute to CARE's expertise in humanitarian and emergency work. Working in 87 countries, we have been present in these communities for sometimes over 20 to 30 years, which provides a strong platform for humanitarian response if need be. We focus on gender equality and women's empowerment in all sectors of our work: food security, shelter, water and sanitation, hygiene, and reproductive health. We work closely with and build capacity of our local implementing partners to ensure sustainability. One of the goals, objectives for CARE's 2020 humanitarian strategy that we hope to achieve is that by 2020, 50% of all of our emergency responses will be done by local implementing partners. We also include risk analysis planning, that is the identification of the vulnerable populations. Why are they vulnerable? Where are they located? And resilience strengthening activities in our development projects. Humanitarian aid agencies' main role is to help people prepare for, respond to, and recover from disasters. During the preparedness phase, CARE country offices, working closely with our implementing partners, this could be the community, Ministry of Health, etc. We develop emergency preparedness plans and interventions based on anticipated scenarios that could bring damage to the community. For example, the potential for political conflict in South Sudan and the floods in Pakistan were two scenarios that these country offices prepared for. So when they actually happened, CARE was ready and able to respond immediately. Once an emergency occurs, we are ready to respond and provide prompt and appropriate assistance, either through a direct deployment to the crisis-affected area, as well as distributing needed items such as food, shelter and construction supplies, reproductive health and hygiene kits. An example, again, is our work in the Philippines, where we deployed a team within days after Typhoon Haiyan struck and started to get supplies to the communities in need. From here, we move into the recovery phase, where we help restore the capacity of the communities to rebuild from the crisis. Populations become more stable and are able to resume a more normal existence. Local markets will start to open, children can go back to school, and religious and cultural festivities will start to take place. 5 years since the earthquake in Haiti, CARE continues to work with the population to rehabilitate healthcare structures and systems. These steps are ongoing and involve a substantial amount of planning and coordination among the NGOs, donors, local communities, and governments. I'll now provide some examples of what works well from a public-private sector partnership, and I'll also talk to you about some of the challenges that CARE faces. In the preparedness phase, an example would be our 20-year partnership with UPS, who provides CARE with free shipping of emergency supplies. We pre-position these items in UN warehouses around the world in anticipation of an emergency. We also benefit from a direct grant to our emergency team and from long-term investments in CARE's internal supply chain, allowing us to better track critical food and non-food items that are delivered to our beneficiaries in need. We also have a newer partnership with Intercontinental Hotels Group that gives an annual general operating grant to CARE's Shelter and Emergencies team to design innovative solutions to shelter needs in emergencies. In 2005, after the Asian tsunami, Emirates Airlines started a partnership with CARE to provide CARE staff free seats to fly to any of the disaster-affected communities. And finally, for the past decade, CARE and Procter & Gamble have partnered together to provide water purifying packets. These packets, as we saw earlier today, bring clean and potable drinking water for refugees and help reduce the spread of waterborne diseases and outbreaks. These partnerships demonstrate a natural linkage between CARE's needs on the ground and the core business strengths companies bring to those needs. When we are able to leverage these business strengths, we find in our experience a long-term partnership is created and sustained. As mentioned in the previous slides, UPS utilizes their expertise in shipping and logistics. The donations from IHG and Emirates fit their business model. A shelter grant from a lodging company such as IHG and free seats from an international airline like Emirates. The manufacturing and donation of water purification packets comes straight from P&G's Health and Hygiene business unit. Where we have found success in the recovery phase is around support of our philosophy and approach. Our partners know that we are going to respond once an emergency strikes, and also know that we will be in the community long-term, helping during the recovery phase. So along with these examples of successful partnerships, there are also some challenges. Most notable is our struggle to attract private sector investment in the preparedness stage. What I mean to say is that we lack the proactive investment to an emergency. Some of the reasons for the lack of investments during this phase may be that preparedness work can be viewed as boring, and it's hard to monitor its impact and effectiveness, especially if you do invest during this phase and then a disaster never happens. How do you measure it? Was that worthwhile? We also notice that the majority of private sector giving happens after an emergency strikes. That is reactive giving. We sense this is because that donating after an emergency it's a tangible and visible gift. It can be emotionally gratifying, and the impact of the gift can be much more easily measured. However, it is more beneficial for communities to have the investment given to them and supported during the preparedness phase, and it makes better economic sense for donors to plan ahead for emergencies. Research has shown that for every $1 that is given during the preparedness and planning phase can save up to $4 to $7 during response costs. During the response and recovery phases, we also struggle with finding funding and support for slow-moving disasters, like droughts and famines in West and East Africa. Most likely because there is the lack of a distinct start date, and there's low media coverage as these situations tend to build over time. Funding for man-made conflicts like Syria and South Sudan is also difficult, as donors may see engagement with these countries as politically complicated. But let's keep moving forward. I'd like to end on giving some thoughts for additional discussion and actions that we can take together as a group. For the NGO community, let's work together to advocate for more support during the preparedness phase, highlighting the benefits from a humanitarian point of view and the business impact. We know that it is more cost-effective to provide funding during this phase rather than only during the response phase. When working in conflict areas such as Syria, talk directly with the private sector about the apolitical nature of our response, guided by the humanitarian principles. For the corporate partners in the room, become private sector champions and talk about why you are investing in planning and preparedness. Tell your story and share your impact. And for those of you that are not yet involved in preparedness activities, think about piloting a project in this area. So we really want to encourage the private sector to engage with us, the humanitarian actors, during all phases of the humanitarian program cycle. Thank you.
Thank you, Carolyn. That was a wonderful presentation. I was very interested in the figure that $1 spent in preparedness saves 4 to 7, I think you said, in emergency. How well is that known, or is that just known in the aid community?
It's well known. In fact, I actually have the source written down. It is from the Development Initiative report from the globalhumanitarianassistance.org. And that's pretty conservative. They say it can even go up to $12 depending on the size of the emergency, the level of damage that's been caused. So I kept 4 to 7, but sometimes the range can go up to $12. And this is a figure that people will use and toss around.
Right. Okay. That I would encourage you, as you're speaking to your corporate donors, to use that. That means something to them. That's the sort of return you get on advertising. That's very impressive. And of course, in preparedness is apolitical. So that is a good time to get people engaged. Kathy.
Hi, thank you, Carolyn. That was a great presentation. And so I'm just wondering if maybe this is for the more general discussion to talk about preparedness versus resilience and how they're the same and how they're different and how we can kind of leverage some of the same energy to contribute to both outcomes.
So maybe I can start just real quickly with the preparedness phase of it. Really, it's kind of it's part of resilience to some degree, but really that's the phase where you're talking about the training and the building the capacity, setting up the systems. It's more than just the pre-positioning of goods. It's really getting the community to understand and identify what the issues may be or the disasters that may happen. In different sectors, there are different ways to address disaster risk reduction and conduct the preparedness. The resilience kind of takes it to the next step, saying, okay, once it actually happens, how will you recover? How will you absorb the hit? How will you be able to move forward in a successful and effective manner? So it takes it kind of through the continuum of the resilience. So it's kind of the next stage after preparedness. But certainly preparedness would feed into the resilience activities.
Another aspect to that that I found very interesting is that very often the people that you're helping then become part of your resource in dealing with and becoming resilient. A charity that I serve on is Help Age International, and which is to protect the dignity of older citizens in the world. And that became very clear during the Philippines disaster, for example, that older people are, of course, vulnerable, but they're also very resilient and can be a very important part of your initiative after you've got aid on the ground in trying to get back to where you were. So I think that's a bit. Does anyone else want to talk on that one in particular, add to that?
If I just add one more comment to that as well,
Sure.
is that also this is why it's very important. We talk about partnerships and working with the community. This lends itself, as well as the CARES philosophy, and a lot of humanitarian activities are moving into this model. They're most likely the population, the community that will be most affected by the disaster. They will most likely be the first responders on the ground. So that's another reason that preparedness is so important when you work with the community, because if it happens, they're going to be the ones to handle it, share the information, and be able to respond accordingly.
Thank you. BT, you couldn't get your tent to stand up, so.
I was having a little difficulty there. Thank you for the wonderful presentation. It's wonderful to hear about the activities of CARE. I'm also fascinated by the fact that the analysis shows that for every $1 invested during preparedness times, that it could be a multiple of 4 to 7 times. And I've also seen that you've done some work in terms of services provided and goods provided with intercontinental hotels and Emirates and whatnot, looking at creative partnerships. Have you ever looked at possibly approaching banks or even the Gates Foundation in terms of looking at a loan in which it's a long-term loan, let's say 3 to 4 or 5 years, in which you can leverage that loan and bank it off? If you have the cash that comes in with such a loan, then you can use that with the leverage of about 4 to 7. And I think in this day and age, it's just a matter of time in which there's another disaster in the world. So with that, it's, and I guess worse to worse, if it's 5 years out, I don't think that a creative partner such as a bank or even a foundation wouldn't mind just writing off the loan at that point. So just a thought.
Very good one, thank you. I took a note on that.
Do you want to ask a question?
Okay.
Sorry, yeah, thanks. Actually, Ambassador Lang and I were talking during lunch about preparedness and the challenge in terms of convincing those with resources to invest when there are a number of ongoing concerns that are still not met. But yet when you have invested, there are often unintended benefits, so to speak, in doing so. And I was describing the example of work I had been involved with previously in developing disease surveillance, preparedness, and response capabilities in the Mekong region. And that was really, the impetus was avian influenza, and it engaged the 6 countries, including Myanmar, which is under sanctions at the time. And then when Cyclone Nargis hit and external aid sources were not able to go in a reasonable time frame, the networks established and the capabilities for preparedness and planning that had been established actually were able to. And so I think often we may be sort of thinking about singular preparedness when in fact we're looking, and maybe this is the link to resilience, we're looking at building systems of capabilities and collaboration so that if something unexpected happens, the impact is reduced.
They can be deployed.
And just one other example, which I think doesn't get enough mentions at times, is PEPFAR. PEPFAR was an emergency response to HIV, but one of its main outcomes is a system strengthening that happened. The laboratories got established, and there was training on reporting and laboratory diagnostics and treatment. And then you had to look at the entire primary healthcare system and transport and referrals, and it got bigger and bigger and bigger. But it started off as like a response effort. But this kind of, the lines are no longer black and white and vertical. There's a lot of overlay of what these activities can do in preparedness. So.
We got a wonderful presentation this morning around PEPFAR, which showed that the transition from that emergency into maintaining and now into system strengthening, it was really and the job of the director of PEPFAR has become very different over the years. I saw Brenda there and I saw Carol. So Carol, please remember.
I had one question related to the issue in the Philippines and resilience, disaster preparedness. I mentioned this morning that we are preparing with the Philippines a forum and in August next year, and part of the showcasing that they want to do is about disaster preparedness. And in fact, they claim a substantive amount of investment over the years in very technological, scientific prediction of what's going to happen. And in fact, the governor of the state of, I believe, Albay, although I'm not an expert on the Philippines, where Haiyan hit, claims to have absolutely no mortality in that province because of an extensive investment in technological risk prediction. So resilience not based on community level activities, but on high level technological investment. Would CARE go in that way? Would you stop there, or what would be your interaction with all potential routes towards community resilience?
Absolutely. So we're also looking, for an example, would be the work that I'm doing in Pakistan with reproductive health at the national level. And we're looking at creating disaster risk assessments for reproductive health within their health management system and their disaster preparedness one, and making sure that reproductive health needs are incorporated and addressed in case of emergency, whether it be conflict or flooding. So CARE is actually looking very closely at kind of at that top line, DRR, disaster risk reduction, and risk analysis at the top line within governments. And I think the Philippines was a great example of that. One other quick little example is in India, right after the Philippines, there was the hurricane that hit India, and I think the mortality rate was incredibly low because of all the preparedness plan they had done. They were able to evacuate the population on the ground, so they were able to avert that.
Last question.
It's actually just a comment, and I'll be quick. So I think you can actually sell this investment mechanism to corporations in terms of the benefit it brings to companies in terms of their effectiveness and efficiency in responding to disasters. And just as a quick example, Merck has recently used this mechanism. We provide funding in advance for disaster preparedness to certain organizations. And we've also worked with two of our partners who receive our donated medicines to pre-position products to prepare them for disasters. And what it does for us is when the disaster happens, it gives us some breathing room. We know that we've already done something. So all the pressure that's being levied for us to react, to respond, we have a little bit of space to think about and be more thoughtful about. So in addition to what we've already pre-positioned, what more can we do? So it's actually a selling point. I mean, it's actually kind of taken the pressure off of us and given us an opportunity to be more thoughtful in our response.
Great, thank you. That's a good
Thank you
point.
very much.
Helpful.
Well, thank you to our panel. Please. So, Joe,